does this effect last beyond the time that the patient is taking the peptide? And I had made a note about, my understanding is peptides should be kind of pulsed and not taken continually. So maybe you can talk about dosing.
Yes. Okay. So first of all, to answer that question, does it last? It lasts as long as I've dealt with the multiple root causes, right?
Got
If
it.
the multiple root causes are still insulting the patient, the immune system is still going to be reacting to those things. Now, another interesting thing is we can remove patients from the root causes, and their immune system is still acting up. It's like the immune system then needs retraining, right? So
Mhm.
you might notice after your infections have been killed, after you've been detoxed, after you've done all the things that you've needed to do to address the root causes, you're still sick. Well, we need mitochondrial repair. We do need to retrain the immune system, and peptides definitely come in for retraining. My goal is to not have my patients be my patients. When my patients graduate, I am so happy, right? Because I want them to have their life back. And it's such a special time when that happens for each person. Now, peptides absolutely help with retraining.